And these must be taken from outside as the body cannot make inside. And from the first one, we can get the arachidonic and the adrenaline. And from the second one, we can get the icosapentaenoic and the DHA. So it is essential to take it from outside the body through nutrient or through supplementation. We are concerned with omega-3 and omega-6 in this talk. The omega-3 fatty acids involved in many physiological processes in the body. Since they cannot make in the body, so we call it essential. Examples of omega-6 is the linoleic and the gamma-linoleic and the arachidonic. And the examples of the omega-3, as I mentioned, the apicosa and the DHA and the 3 fatty acids. Although human and can synthesize the icosapentaenoic acid and the DHA from the omega-3, it means from outside, yet the conversion is relatively slow and it is inefficient for the requirements of the body. So therefore the dietary source or the nutritional supplement is very essential. When a person is deficient in omega-3 fatty acids, there is increased incorporation of omega-6. And if omega-6 increase, the cell membranes will be more stiff and less flexible, and the ratio disturbed between the omega-6 and omega-3, and this is essential for the normal neural function. In this slide, there is epidemiological studies indicated the interest in the potential benefits of the specific types of the omega fatty acids during prenatal and early brain development. However, we are reducing the fats in our food, and so we reduce both the fats what we need, where we need it for the brain health and the fat for obesity. So this is a problem now. The pregnant and lactating woman should achieve an average daily intake of at least 200 milligrams of DHA. This is very important now. And all the gynecologists and obstetricians start to give the omega, but before, especially the DHA, but before it was not given at all during pregnancy. And as Dr. David mentioned, very important point is the fish, the kind of fish which we took the DHA from it or the fatty acids from it. It should be known, and because maybe it is one kind of fish with high mercury and making problems with the child. There are many factors affecting the conversion of the essential fatty acids to the long-chain polyunsaturated fatty acids, such as age, omega-6 to omega-3 ratio, diabetes, excess alcohol, and zinc and magnesium status. So zinc and magnesium are essential to be normal in the blood in order to facilitate this conversion of the essential fatty acids to the polyunsaturated fatty acids. Too many diseases are affected with polyunsaturated fatty acids and omega-3, such as all what you see here. This is a mouse. The most important one today, our concern is autism. Our concern is what is the behaviors, the eating habits and food choices, which will lead to health concern. Feeding problems in children with ASD. We published a paper about the feeding problems of children with ASD here in Egyptian children. We found that food selectivity and refusal, obsessive eating pattern, all these are concerned for possible nutritional deficits and imbalance, which should be decompensated. This is the two papers we published on this disease. I want to have a look on this slide. Autism was before purely psychiatric disorder. I'm always putting this in my presentations because it is very important to remind the people that autism or ASD is not a psychiatric, is not a genetic, but it is a complex interaction of genetic susceptibility, what we call the epigenetics, and triggered by an unknown environmental insult. Which insult? A lot of insults. Dr. David give us a lot. We go through this and we are very optimistic, and we discovered a new mutation in autism with epilepsy, and it was published in Science. But what after that? This is a very mild, minimal part of autism or ASD, as it is a spectrum. So we have a lot of different diseases of autism. This is one of the. So it is not the major one, and we started already to treat, but this is very few cases in response to the number. Food, not only food does provide nutrition for the body, but food chemicals can also switch the genes on and off. This is very important, that it is related to the nutrigenomics. It is a science, and it is almost 10 years ago. And it means that the food itself could switch the gene. It means to stop its action or to aggregate, to upregulate its action. So the food is very important, and it's not the problem of the gene, it is the problem of the food effect on the gene. What do we know about the prevalence? This is the CDC. I don't agree. Maybe this is a personal comment, but if there is an epidemic of autism all around the world, I think there is increase. We agree together that there is an increase, but not to the event that it is epidemic, because changes in diagnostic criteria, diagnostic substitution, increased efficacy over time in case identification, changes of age at diagnosis, changes in the policies for special education, and increased availability of services. That this one, the changes of age at diagnosis, is very important. We know we need an epidemiological study to see if it is rising like that or rising like that. It's a curve. It is rising, I agree with you, but not like that. That's why, because the age now, we got the cases, the old cases are discovered, and cases without mental retardation are discovered before we didn't know that there is autism and how to diagnose, and so this all happened in the near days or years. So I think there is an increase, but not to that extent. It is a problem of socialization, problem of communication, and unusual behavior. All of us know that. This also how to diagnose it early, before, in the first year of life. I have cases diagnosed at 1 year, and even 2 months and 1.5 years. So there is a red flags. We have to check that no smiles, and that the child doesn't like to hug, and no back and forth sharing of sounds, no smiling, up to 7 months, which is very unusual or weird. By the end of this 12 months, this means by the end of the first year, there is no waving. Child at 1 year say bye-bye. This is, and not answering to name. We always say, where is Nagwa? The child is braving, and he knows that this is his name, or her name. And no babbling at all. Mama, papa, dada, nothing. Even dada, because this is the first word, I think, the phonetics here, they will help me, that the baby, the child cannot babbling at this age. And then by 18 months, no single words, no simple pretend play. But not all the children with autism know single words. Some of them are speaking and some of them are talking. That's why, because it is a spectrum. It's not one disease. By the end of the 2 years, no two-word meaningful phrases and lack of interest in other children. This is what we call autistic. It's that aware special. The autistic spectrum are caused by genetic predisposition combined with environmental factors that create disordered biochemistry and damaged organs and systems. This is, I want all of us to take care of this slide, because this is a clue for autism. Nutrition affects this chemistry and the body.